Hello, and welcome to another live broadcast with MedStar Health. My name is Amy Cameron, and I'm happy to be here during Heart Month as we discuss a topic that affects nearly half the adults in the United States, high blood pressure, also known as hypertension. Today, I'm thrilled to be joined by two experienced providers from MedStar Heart and Vascular Institute, cardiologist Dr. Alan Taylor and interventional cardiologist Dr. Brian Case, to break down what hypertension really means, why it can be so difficult to control, and an innovative treatment you may not have heard of, renal denervation. We've got lots to talk about, so give us a like, share this with your friends, and if you have any questions for our experts throughout the session, you can drop those in the comments below. We'll get to as many questions as we can. Before we get started, let's meet our experts. Thank you both for joining us. Could you each tell our viewers a little bit about yourselves? Dr. Taylor, do you mind starting?
I sure will. Hi, everybody. I hope you're having a terrific day. Thank you so much for joining us. My name is Dr. Alan Taylor, and I am a cardiologist with MedStar Health. In my role, I'm the chairman of cardiology in the Washington region. So I work at Georgetown University Hospital and over at MedStar Washington Hospital Center, and partner with Dr. Case down at MedStar Southern Maryland Hospital. And while I run the department, I also do a lot of clinical medicine too. And one of my favorite areas to practice in is preventive cardiology. That's the idea of preventing first and future heart events in all people. And hypertension or high blood pressure is a key component of that. So while I focus on a lot of things related to prevention, cholesterol, for example, proper activity, diet, hypertension and its control is increasingly important. So I'm glad you're here today because all of our patients who have potential for heart disease, blood pressure is a really important thing to think about. So thanks for being here. Your commitment to your own health is what makes Heart Month so special.
Thank you so much. And Dr. Case, welcome.
Yeah, thank you so much, Amy, for having us today. I'm very excited to be here and talk all things related to hypertension. So I'm Dr. Brian Case. I'm an interventional cardiologist here at MedStar Heart Vascular Institute. I'm predominantly at MedStar Southern Maryland Hospital. As an interventional cardiologist, I am one of the cardiologists who performs procedures in the cath lab. I'm sure a lot of you are familiar about heart catheterizations and angioplasties and placing stents to treat heart disease, which is of course very important. But I'm also very excited to be here today to discuss a new novel procedure that we can easily do in the cath lab to help manage and control hypertension. So thank you so much for having me today.
That's amazing. Awesome. Thank you. Let's start with some of the basics. What is blood pressure and what is considered good or normal?
Yeah, thanks, Amy. I'll take that one. So we all have a blood pressure, and it's quite simply the pressure, like water pressure in your house, how quickly the water comes out of the spigot inside your blood vessels. And you can think about your blood vessels as a tube, but it's a tube of tissue, and that tissue is fragile. And that tube helps both maintain your blood pressure because the tube can squeeze and contract. Your heart pumps blood into those tubes, and the arteries control blood pressure by absorbing that pressure from the heart and determining how much pressure is inside the tube. But if the pressure in the tube is too high, it damages the blood vessel. That kind of makes sense. And it's a silent problem. It's within you. And so we all have a blood pressure, and the higher that pressure, the higher the risk. It's measured in millimeters of mercury, and it has a top number and a bottom number. The top number is the number that is the peak or the highest point of your blood pressure when the heart pumps or pushes blood out into the blood vessels. And then as the heart relaxes and blood's being no longer pushed forward, the pressure comes down, much like a wave washes into a beach and out of a beach. The blood pressure rises and falls as the heart beats. And that lower number is the pressure inside the blood vessel tube when the heart is relaxed and not pumping. And so the technical terms for those words are the systolic, the high number, and the diastolic, the lower number. And both matter. You can imagine that both are pressure in the tube that the blood vessel feels. The peak pressure is that sudden rise, and the lower, the stable pressure, the diastolic pressure, is that continuous pressure inside the tube. So when we measure blood pressure, we measure both numbers. Both are important. And what we know is that number matters. And so it's one point to make here is that it's simply important to know your blood pressure. I'd ask you the question, when's the last time you measured your blood pressure? And some of you may be saying, oh, I just did it 3 hours ago after I took my pills. And some of you may be saying, oh goodness, it's been a little while and I don't really know what my blood pressure is. So one task for us in Heart Month would be to get to know what our blood pressure is. And our point today is to give you a lot of education about blood pressure, how it's measured, what's considered a good pressure, and then how we treat it and how our treatment's evolving into new things, as Dr. K said, like these procedures. So a good blood pressure is a lower blood pressure. And that's the focus. We've had a long time in medicine where we've proposed blood pressures that were higher, but we've learned through studies of treatment of blood pressure and through observing patients and how their lives go. Do they have what their heart risk is as they live their life at higher or lower blood pressures, that a lower number is always better. And we now call optimal blood pressure 120/80, or 120 millimeters of mercury over 80 millimeters of mercury. And that's the higher pressure as the heart pumps and the lower pressure as the heart relaxes. Again, both matter. So one thing to know is optimal is 120/80. And above that, we start saying you have elevated blood pressure. In the 130s and 80s, we say it's elevated blood pressure. And once it's over 140/90, that is legitimate high blood pressure or hypertension. And it's important that at all levels of blood pressure, even these elevated, just simply elevated blood pressure, like 130/85, a number that may not sound too bad, but it's higher than optimal, these days we treat. There have been a few changes. We've changed optimal to lower numbers. So we've moved the goalposts on you. We made the numbers lower for all of us. And so we're all asked to know these lower numbers and achieve these lower numbers, not to be satisfied with blood pressures that we used to call borderline or mild. We really want to go after these numbers and make them better. So we're asked to know our blood pressures and then to begin working on them. And we'll get to the treatments here. But important thing to know is I've given you some information on how's blood pressure generated. It's the heart pumping into the tube. Why is that important? Because the higher pressure is, the more damage the tube can take. And that takes a toll on the heart, the blood vessels, the brain blood vessels over time. And that can lead to things like stroke and heart attack or heart failure. It's a big problem as we age. And then they've moved the goalposts and the numbers are lower these days. And 120/80 is the number to know. And we don't want to hide from that, because if your blood pressure is high, there's simple treatments from lifestyle to very, very safe and easy to take medications that treat it very effectively. So again, when's the last time your blood pressure was measured?
Mine was Monday, actually.
Okay. I'm a little overdue. So
yeah,
I've caught myself here.
I never know. The numbers are always, I just know if it's good or bad. So mine was
I'll
good.
do a pitch on Monday morning at around 8:30. I'm doing a live thing for the local DC Channel 5 affiliate, Fox affiliate, on how to measure blood pressure at home. So if you're interested in that, tune in and we'll give you a little video instruction on how to measure your blood pressure at home.
Oh, that's helpful. That makes it very convenient. You kind of touched on my next question, what blood pressure reading is considered high or bad. You said whatever's above optimal, correct?
Yeah, but let's talk about that a little bit. The higher it is, the worse it is. And a lot of times the question comes up is, when do you even measure blood pressure? If you get on a treadmill, your blood pressure goes up because you're exercising. And that's part of the healthy effects of exercise, is that it sort of works out your blood vessels and keeps them responsive and relaxing normally. But the higher the blood pressure, the worse. And so high is anything over elevated is anything over 120/80. But the higher it is, the worse it is. And we now call numbers that in the past we would, get concerned with, but not think it's critical. We now have changed that to be critical blood pressures. Things like 180 over 100 are really critical numbers because they're such a high value that it's really creating continuous pressure, harm to the blood vessels. And so it's a serious health concern because over time, blood vessel damage leads to artery buildups. And those are the things in the heart that cause stroke and chest pain, or heart attack and chest pain. They damage the brain blood vessels and cause different forms of stroke. And that's one of the biggest risks for high blood pressure is stroke. And you can imagine if your blood pressure is high and the heart's having to push against that, the heart can really take a toll over time and is a risk for heart failure. The good news is these things develop over long periods of time, so it's not a crisis usually. However, it's a silent problem. And one of the problems we have these days is because it's a silent problem, too few patients even know if they have high blood pressure. And even when they're aware of it, national data says we're not controlling it well enough. So one of our call to actions is to know when our blood pressure is elevated and to acknowledge that so we can be not just aware, but then to treat it and control it. And we lose ground at each of those steps: awareness, knowledge, awareness, treatment, and control.
So do you never want your blood pressure to be high, even if you're exercising or say you're getting really upset about something? It's
So
not good to ever go high.
blood pressure is very dynamic. When you're sleeping, your blood pressure is low, and that's a good thing. That's a recovery period, and it should go down at night. When you're active during the day, it will be higher. It's a normal response to stress that your blood pressure goes up, and those brief periods of time of blood pressure rising and falling are normal. That's where some of the benefits of exercise actually arise from, because they keep the blood vessels that rise and fall. That little workout of the blood vessels keeps them healthy and responding normally and able to relax. You want your blood vessels are a big part of this. And how well do your blood vessels function to relax, to lower blood pressure? A lot of the medicines we use to treat blood pressure, in fact, are work on blood vessels and help those blood vessels to relax. There's muscle in the blood vessel wall, and they work on the muscles or the cells in the blood vessel wall. So the blood vessels relax to keep blood pressure low.
Okay.
So a short-term rise in blood pressure is no problem. It's part of maintaining healthy blood pressure, paradoxically.
Okay. How and when does a doctor diagnose a patient with hypertension?
Yeah, you hear these terms like white coat hypertension, and a few things. One is when you go to see one of your healthcare clinician, it's important you get your blood pressure measured. Oftentimes, that's not the most optimal situation. You just had a difficult commute to the doctor's office. You've struggled to get parking. You're running a few minutes behind, or they're running behind and making you anxious. And then they sit down and get your blood pressure measured, and we'll get elevated numbers. And that it's important to know that we need to measure blood pressure in a relaxed setting.
Okay.
Comfortable, relaxed setting, not right after eating, not right after stress. And so the office blood pressures can be high, in which case we'll ask patients to sit and relax for a few minutes to try to get a relaxed blood pressure number. And that's how we'll diagnose hypertension. But it's important that patients can bring in their own numbers from home. If you don't have a blood pressure cuff in your home and somebody's birthday is coming up, it's a great birthday present. They're inexpensive. They're very accurate. The right ones are the ones that go on your arm. There's some that go on the wrist or the fingers. It's really preferred that you measure the arm blood pressure in the upper arm, because there it's a larger blood vessel and it's more reliably detected. Okay. So that's the preferred way. And at home, you do it exactly the same way: seated, arm resting, legs uncrossed. Relax, do some Zen for a few minutes. Just put on some music, listen, think about something pleasant, do some deep breathing, and then take it. And if it's high, elevated, relax for another 5 minutes and take it again. It's that seated, relaxed blood pressure. And write the numbers down. I love it when patients come in with blood pressures from home, because I can see how much it varies. I can see the average numbers. And I I get a lot more information than just the
Mhm.
one or two that we do here in the office. Gives me a lot more confidence that we're treating. Some patients will have what we call white coat hypertension. That is patients that reliably have high blood pressures in the office, but when they're home and relaxed, they don't. And we like to know that because we certainly don't want to treat patients unnecessarily. Some patients have the reverse, believe it or not. Their blood pressures at home are high and they're better here. I don't understand that one.
Interesting.
Maybe they just like the doctor's office. Um, but that can happen. Even that can happen, and that's
Yeah.
so-called masked hypertension. But key thing is we want measurements, and we look for patterns over time. Well, we won't diagnose it, Amy, off a single number.
Okay.
But when we see an elevated number, and if you go to your doctor's office and it's 120 over 80, don't be inclined just to, oh, it's high, always high when I come to the doctor's office. At that point, then you say, well, you got to get a cuff and do it at home, do it correctly. So we really do know because we want, again, that's to the awareness. We want to be aware of what our blood pressure is. You can't feel it. You have to measure it.
Hmm. I'm gonna have to get my parents one for their house.
Happy anniversary.
Right. Who is at risk for having high blood pressure?
Every human being. Literally, by the time it rises with age, if you're 50, over half of people over 50 have high blood pressure. So, you know, look to the person to the left or the right of you, and if you're over 50, one of you has high blood pressure. Um, I think we have to really get the word out that the numbers people are running around in their mind, and I've been doing this for over 30 years, and I can remember when if it was under 140 over 90, we said it was okay. So we're all having to adjust to these new lower targets and unlearn what we learned and start calling blood pressures elevated when it's in fact in ranges. In the past, we used to say that's a good number. Again, 120 over 80 is the right number, but it's very age related. It is related to, there are risk factors for high blood pressure besides just aging. Principal among those are diet, and how much salt is in our diet is an important component. A little tip and trick is, there's some salt substitutes out there that are potassium salt. They call no salt, and actually they lower blood pressure, which is interesting. So there's sodium salt, which is the kind of salt in a Morton salt, that typical salt shaker salt. But there's a potassium salt. It tastes just like salt, but it's a different type of salt and has potassium in it. So dietary sodium matters. Exercise, people that exercise less or have a tendency to have trouble controlling their body weight are more at risk for blood pressure. So there's many factors, and there's hereditary conditions that contribute to blood pressure. Patients with kidney problems will have higher blood pressure because the kidney doesn't handle salt and water appropriately. So there's many conditions that lead to high blood pressure, but if there's one to remember, simply by getting older, you are more likely to have high blood pressure. The number is, by the time folks are in their 80s, 3/4 of people have high blood pressure. So it becomes the norm. It's really the norm, not the exception. And it's almost as if you have high blood pressure, you should say, "Thank God I'm normal." But we don't like the fact that it's high, so we do have to treat it.
Okay, thank you. We do have a question from our audience. Wendy, thank you for your question, asks, why does the criteria for elevated blood pressure change from childhood to adulthood?
Yeah, I think that so it has to do, and I'm not a pediatrician, but or a pediatric cardiologist, but blood pressure rises with age, and so it is these numbers 120 over are the adult numbers for blood pressure. It has to do with the fact that the blood vessels mature, and there's growth and development that is constantly changing as a child, and that's why blood pressures rise. But for all adults, the number is 120 over 80. And if children have high blood pressure, then often it's connected to some medical conditions, and we'll look for those.
Okay. Thank
Good
you.
question.
Back to our other questions. What are some symptoms of high blood pressure?
Yeah, well, the most common thing is there's no symptom. And so if you're sitting there saying, I feel pretty well, I'm sure my blood pressure's okay, you you really can't tell because you can't feel your blood pressure. Now you may say, well, I know when my blood pressure goes up. It's when my blood pressure is 180 over 100. I feel lousy. I have a headache, and I feel tired, and I feel anxious, and you will feel high blood pressure at these extremes. But these kind of stable levels of high blood pressure you want to treat are asymptomatic. So that's why it's called the silent killer.
Mm-hmm.
It's within you, and it's as if you're looking at your pipes in your house. You're looking at your faucet. You have no idea what your water pressure is until
Right.
you turn the spigot on, and the water just drips out or it comes blasting out. Yeah, it's that same idea. So that's why you have to measure it. But if you were to have symptoms of high blood pressure, it typically would occur at very high levels. It would be things such as headaches are a common symptoms, visual blurring, shortness of breath, or chest pains at extreme levels because of the stress it's placing on the heart and the blood vessels. So at very high levels, blood pressure can be symptomatic, and that is a crisis. If you're ever having symptoms from high blood pressure, that is what we call hypertensive crisis, and
Mm-hmm.
we have to get patients to emergency medical care to begin to bring their blood pressure down on a more urgent basis. So be aware of that. If it's symptomatic, it's really a problem. For the vast majority of patients, blood pressure is a silent killer because it has no symptoms.
Okay. Why is high blood pressure such a serious health concern?
Because it's so common. And heart disease and blood vessel disease is still the most common cause of death in this country. 2 in 3 men and 1 in 2 women will develop heart and blood vessel disease in their lifetime. And blood pressure, as I mentioned, is so common and such a treatable thing that we really do need to get better control of it in our society to lower the risk of heart and blood vessel disease. There's nothing more devastating to take the life out of your years than a stroke.
Mm-hmm.
There's nothing more devastating to a family than the death of someone from, a sudden blood vessel problem like an aortic rupture, or your blood vessel rupturing, or an acute heart attack. And so we have to know that, whether it's our aging parents or ourselves, caring and knowing what your blood pressure is very important for their health and vitality. And if we were to do a better job at it, then we wouldn't have as much heart and blood vessel disease in this country.
Wow. When someone is diagnosed with hypertension, what can they do to manage it?
It's a terrific question. A lot of the management is self-management. And it is truly things like behavioral therapy, like relaxation, can help control it. Stress is an important contributor, particularly when I say stress, it's the type of stress that never goes away. It's that stuff like job stress, relational stress, work stress, financial stress, those things, trying to eliminate stress in your life, and say maybe easier said than done sometimes. The diet and exercise is so important. Losing 10 pounds would normalize blood pressure in most people.
Wow.
Think about that. Losing 10 pounds would normalize blood pressure in most people, as opposed to taking a medication. It's why we're seeing so much success with all the new weight loss drugs. They lower blood pressure. Part
Right.
of their benefit is lowering blood pressure. In fact, so much so, sometimes we have people that are taking blood pressure pills. They're on these new weight loss drugs. They're losing weight, and we have to back off on their blood pressure drugs.
That's
And as a real demonstration in them that, yeah, your weight was contributing. Diet is such an important element to this. And I think diet is something all have. We all have very similar diets in a lot of ways, in that we eat what is largely an American processed food diet with a lot of salt in the foods as a preservative. It comes in bags and cans and boxes, and salt is part of the production process, and you can't get away from it, which is why moving towards an unprocessed diet of fresh foods is a healthier diet from a heart and blood vessel standpoint, and lowers blood pressure. Certainly, if you use a salt shaker, you should first choose to give up your salt shaker. Or if you say, I need that salt shaker because I can't eat watermelon without salt on it, use the potassium salt I mentioned. Get some of that no salt. Um, uh, you know, if you've got advanced kidney troubles, then you talk to your doctor first. But for the most patients that little bit of salt intake with potassium salt lowers blood pressure. There have been studies done, for example, very, very large scale population studies in which they've substituted potassium salt in the population, and they show that the population's blood pressure comes down,
Wow.
which is really quite interesting to me. Certainly give up your salt shaker. If you use one, think about the no salt alternatives. And then I think the other problem we have is the sort of convenience food life that we live a lot with, eating out, eating convenience foods. You can imagine, some of the convenience foods, things that have sauces like pizzas and Chinese food and, delicious, but, fried foods, these have a lot of salt in them. And you don't think about it because you don't see the salt, but it's in there. And even our dietary habits have accustomed our taste buds to higher salt thresholds. And so we don't taste salt like we used to. If anyone out there listening has given up salt in their diet or eating a low salt diet, you become recalibrated and you suddenly eat something salty and you say, oh my goodness, that's so salty.
Yeah.
So and then it comes to exercise. And the key to exercise, and we're watching the Olympics right now, and all these high trained athletes, is you don't have to be training for the Olympics to improve your blood pressure. Simply walking and brisk walking is the best exercise from a heart and blood vessel standpoint. You don't have to feel like, oh, if I can't go out and run, I'm not getting any benefit. Brisk walking is perfect. And we want to do 30 minutes on most days of the week. And with that type of a program, watching your salt in your diet, using potassium salt substitutes, and controlling your body weight, many times blood pressure comes under control. When it doesn't, then we go to medications.
Okay. What does it mean when someone has blood pressure that is uncontrolled or hard to treat? Why would medication not work for some?
Well, we have so once the lifestyle things we go through, and if sometimes blood pressures are right high enough that we go right to medications along with lifestyle change at the same time because it's such a high level. These days, over 140 over 90, we will typically go right to a medication while we do lifestyle. We can always back off on the medicines if lifestyle changes kick in, but we don't like those levels. That said, we use medicines, and the medicines are extremely safe. You may have, some of the horror stories of medicines that were used in the old days. They were hard to take. Had to take them too frequently. They weren't daily forms of medications. They had side effects. The medicines we use these days are very safe and effective, really have placebo level symptom or side effects. These are common drugs such as angiotensin receptor blockers, a fancy name. Some of those drug names are things like losartan or irbesartan or candesartan. They worked through the kidneys to relax blood vessels, and they're highly effective and safe. Some blood vessel relaxers, things like nifedipine or amlodipine, are very common and safe drugs, really with no side effects, or simply acting to relax your blood vessels. And some of the other common blood pressure pills are diuretics, or medicines that act through the kidney to have the kidney release some sodium out of your body to lower blood pressure. So those are common medications. And if you have high blood pressure, it's likely you're on one or more of those drugs. Sometimes it takes multiple drugs to treat hypertension. And this is getting to the point of knowing, how do we control it? And to control it, we still want optimal numbers, 120 over 80. So we'll use more and more medicines to get control of the problem. And when medicines are failing, though, and despite taking multiple medications, 3 or 4 medications, and blood pressure remains over 140 over 90, we simply can't get it down. It makes us think of a few things. Sometimes there are conditions in the body that are driving your blood pressure in ways that are beyond normal. These include some things like hormonal imbalances, or some very specific blood vessel problems that can drive blood pressure to the point that it can't be controlled with medications. There's this secondary or this outside cause of the blood pressure, and it's more than a medication can handle. So when we find people that we can't get control of blood pressure with medications, we will think about those things. The most important thing first, though, is to make sure that patients that are on medicines are taking them faithfully. So the key thing you can do is when you've got your prescription for medications, organize them in a pill box, take them faithfully, so that when you come into the doctor's office, you get blood pressure readings. You can say, yes, that's the true blood pressure reading on the medicines you've prescribed. So adherence is really important, and it's easy to forget medications if we don't organize them, and a pill box is the really good way to do it. And then we'll call so-called resistant hypertension or hard to control hypertension when, despite medicines, it's failing. And then we'll look for a few medical causes that can be underlying it. Fortunately, those things aren't very common, but they're pretty easy to detect. And if we don't find those, it really gets a matter of just continuing to escalate medications. But that's where this new treatment, renal denervation, pops in, because now we have a way when blood pressure just simply doesn't want to come under control with medications, and there's not anything else in the another medical problem that's driving it. We have an approach to, through a very simple procedure, to lower blood pressure, to really help patients that are doing all they can lifestyle-wise, all they can medication-wise, but they still can't get control. And this is not uncommon. This idea of resistant hypertension is out there, and probably estimates are, it could be as much as 15% of patients with hypertension have what we call resistant hypertension. We'll run patients through a period of time where we really work on medication adjustments. We work on adherence to the medicines and try to get control. But still some that doesn't work, and their blood pressures just can't come under control with pills or lifestyle.
Thank you. Before we kind of switch gears into talking more about renal denervation, I just wanted to pause. And if you're just now tuning in, thank you so much for joining. We're here during Heart Month discussing a topic that affects nearly half the adults in the US, high blood pressure. We're thrilled to be joined by two experienced providers from MedStar Heart and Vascular Institute, cardiologist Dr. Alan Taylor and interventional cardiologist Dr. Brian Case, to discuss what hypertension really means, why it can be so difficult to control, and most importantly, an innovative treatment you may not have heard of, renal denervation. We did have a couple questions come in from our audience. So before we start talking about renal denervation, we had a question from Charlene, and you kind of touched on this, Dr. Taylor, but when is the best time to take your blood pressure?
Hi, Charlene. Thanks for the question. Well, it's anytime as long as you're in a relaxed state. But we do prefer that patients take it when they usually in the morning is a good time. We'd like to know after you've taken your pills. So take your pills an hour later, take your blood pressure. People have busy lives, though. You can't always schedule this. So we're happy to get a nice relaxed blood pressure at any time of the day. And sometimes we'll ask patients, particularly in the early monitoring phase of medicines, to take it several times a day, morning and evening, say, so we get a sense of how blood pressure is changing through the day. Any time of day, just write down the time. Right after eating is not the best time. Right after exercising is not the best time. Right after driving home is probably not the best time. So, but anytime you can be in a relaxed state and give it the 5 or 10 minutes it needs to get a good measurement, that's the right time. I would say that most patients do morning blood pressures, and I ask them to get them after they've taken their pills, so we can see that on the pills that they've got good control.
Thank you. And then from Jonathan, what role does ABPM play in the initial diagnosis and ongoing monitoring of hypertension? And if you could tell us what ABPM means.
I sure will. Jonathan's throwing a curveball at you, Amy. Yeah, so ABPM stands for ambulatory blood pressure monitoring. And Jonathan asked a good question. We have this ability to do what we call ambulatory blood pressure monitoring. If you've ever worn like a heart rhythm monitor where you wear it around and it measures your heart rate for days at a time, it's like that, except it's a blood pressure cuff. It's literally a blood pressure cuff that patients will wear for a 24-hour period. And every 15 minutes, it'll take your blood pressure. So we get blood pressure throughout the day. And the normal pattern is while people are awake, blood pressure's higher. And as people sleep, blood pressure should come down. And that's a natural reduction of blood pressure at night that we call a dipping pattern. And it's a sign of blood pressure health and good blood pressure rate, but good blood pressure control by the body. We'll use ambulatory blood pressure monitoring, Jonathan, in times when for example, we're not sure what blood pressure control is. We've got measurements all over the place. And so we got to get a lot of measurements across an entire day so we can average them. And we'll do when we worry that there's maybe a pattern that people aren't dipping at night and their blood pressure staying up at night. Or we'll do it when we're worried a patient has masked or white coat hypertension. In other words, we get high measurements in the office and they're low at home. And we want to make sure that we're not being misled by home measurements. Bringing in your cuff to the office and taking the blood pressure with your cuff and our cuff at the same time is one way we'll get around that. But I think ambulatory blood pressure monitoring is sort of considered the gold standard for diagnosing hypertension and for assessing its control. And it's a nice test. But oftentimes we find that through a nice battery or collection of home measurements, supplementing it with our measurements, we really get to the same point.
Okay. Let's switch into renal denervation. How do kidneys play into the naming of renal denervation?
Yeah, a great question and a great start. So renal denervation, as an overview, is a minimally invasive catheter procedure to help treat this resistant hypertension. The word renal is for the kidneys, and you might say, we're here Heart Month, why are we talking about the kidneys? The kidneys actually play a major role in the blood controlling your blood pressure. So the kidneys are kind of like the filter of the body, so they get blood flow to them. And around the kidneys are sympathetic nerves, a certain type of nerves. And based off of how the blood flow is and other markers within the body, that results in increasing your blood pressure and drives that number up that Dr. Taylor was talking about. For patients who have resistant hypertension or uncontrolled hypertension, where despite being on 3, 4, 5 medications, that blood pressure is still elevated, the nerves in the kidneys for those patients are essentially on overdrive, right? If you think about like a stereo system, the volume's at a 10 out of 10 at all times for those patients. And with renal denervation, we can do this minimally invasive outpatient procedure, which we'll talk about in more detail, where we can go directly to these nerves. We can target these nerves, alter them slightly but safely, and really take that volume from like a 10 down to like a 4 or 5, which will subsequently result in blood pressure being lower for the patient overall and in the long term as well.
Wow, that's amazing. Who is a candidate for renal denervation?
Yeah. So I think the first thing to emphasize with renal denervation is it is not a cure for hypertension. We are not doing this procedure just to, fix hypertension and get the patient off all their medication. This is an adjunctive tool that we can use in conjunction with the medications that the patient is taking in order to really get that blood pressure numbers to a safe goal. So when we are evaluating a patient for renal denervation, it's not like okay, sounds good, let's get them, the procedure tomorrow. It really is a very thorough evaluation by myself, Dr. Taylor, other great cardiologists here at MedStar, where we can do a full evaluation, ensure that the patient truly has resistant hypertension, meaning that their blood pressure is still elevated despite being on medications, ruling out those secondary causes that Dr. Taylor mentioned, these easily identifiable and modifiable disease processes that can also elevate the blood pressure that we can target instead of doing renal denervation, ensuring that their blood pressure are elevated on like multiple readings, so in the office, but also outside of the office at home. And that's where the ambulatory blood pressure monitoring actually helps a lot. So that was a great question from the audience. All of these factors, we ensure that the patient that we are considering for renal denervation is appropriate, truly has uncontrolled or resistant hypertension, and that we can have the patient undergo this procedure to really target their blood pressure. Another big thing that is beneficial for these patients are, you're on 4 or 5 medications and we're doing a good job controlling the blood pressure, but is it impacting your quality of life? Like, are you having really, really bad side effects from these medications, maybe these higher dose medications? And we're getting to that number that you like or that we want, but you're just not doing what you can in your everyday activities. That's another kind of patient group that we can consider renal denervation for, where we can try to lower the blood pressure, maybe pull back on some of those medications or the dosage of those medications. So the blood pressure is well controlled, but the patient isn't crippled by the side effects of their blood pressure medications.
Mm-hmm.
The last thing to emphasize with appropriate patients is it's truly a shared decision making, where every patient is different. The management of the blood pressure is different. No two patients are the same, and it's very important to for us to have a real conversation with the patient, understand where their numbers are, understand the medications they're on, what our goal is, what their side effects are, and if these alternative therapies could be beneficial for them to impact their quality of life.
Are there other benefits to renal denervation besides potentially coming off of some of those medications?
Yeah, absolutely. So, and this is all based off like evidence and studies. Patients who undergo renal denervation, so this minimally invasive procedure, on average, their blood pressure decreases by 10 millimeters of mercury. Okay, and so that top number goes from 140 to 130. And you might say that really isn't that great, right? Like that's only 10 millimeters of mercury. Really, does that have a big impact? The answer is yes. We do know that even a 10 millimeter mercury decrease in blood pressure reduces your risk of future stroke, a heart attack, heart failure, which is like a weak heart, and kidney disease. So even a 10 millimeter mercury decrease in blood pressure has substantial impact on your heart health in the future. The beautiful thing about renal denervation as well is it's a one-time procedure where we alter the nerves. And there's a concept called on therapy, meaning when you take oral medications, they're effective throughout, but you do have these kind of like ebbs and flows in the efficacy or how effective the medications are. The renal denervation, the impact of it is constantly on, meaning it's always resulting in that lower blood pressure. And we're learning as we follow these patients at 3 years, 5 years, that on therapy, that procedure you performed has impact on the blood pressure long term as well, where some patients were even seeing like a 20 millimeter mercury decrease in blood pressure up to like 3 years after the procedure is performed. And the goal again is we're not going to cure the blood pressure, but with these changes, we can either decrease the dosage that the patient is on so they feel better, or fingers crossed, maybe get them off of one or maybe even two of their medications, so the blood pressure is easier to control.
Wow, that's amazing. When does a doctor decide this procedure would benefit someone?
Yeah, again, so we do our complete evaluation here, at MedStar. The patient will be seen by a cardiologist in the office. We'll rule out those secondary causes. We'll ensure good medication compliance, and we've really tried to optimize medications as best as possible. We have to do one test just to make sure anatomically that the patient is suitable for the procedure, but it's a basic ultrasound. There's no radiation exposure or anything like that. And then here at MedStar, we have our program where we'll meet as a team and we'll discuss patients that we might believe are appropriate, and then review all the information. And at that time, we'll make the final decision if we think it's worth going forward with the procedure.
Okay. And you mentioned it's an outpatient procedure. What does that mean? And is anesthesia involved?
Yeah, so the procedure itself is quite simple and very, very safe. The risk for complications are the same risk of any other heart catheterization that are done every day in the cath lab across the country, less than 1%. So if you've ever had a heart catheterization before, if you've ever had a stent placed, it is the exact same experience, but I'm happy to go through it in a little bit more detail. So it's an outpatient same-day procedure, meaning you would come into the hospital, we would do the procedure, and you would go home. The procedure is performed in the cath lab. The cath lab is where we do procedures. It's not technically a surgical operating room area, but it's a procedure room. This procedure does not need general anesthesia. So you're not going to get intubated. You're not going to go quote unquote under. We give you what we call moderate sedation, where we get you nice and relaxed in la la land, where you're calm. And to be honest with you, you're kind of forgetful of the procedure and it's over before you know it. The procedure itself takes about 45 minutes. We will apply some local lidocaine in the groin area, the femoral area as we call it, the same area that we do heart catheterizations in. The lidocaine is like kind of the only part you'll feel. We bring a very small catheter up to where the kidneys are. There's two kidneys, and we will target the nerves in both kidneys. We deliver a little radio frequency ablation. That's what's commonly used in EP procedures, electrophysiology procedures. Alter the nerves. Again, this takes about 45 minutes, and then we take everything out. There's no equipment that's left behind in the body, and then we will close the little hole that we made in the groin site, and then we monitor the patient for about 3 to 4 hours after the procedure, mostly for the area that we went into in the groin, just like again we do with any other heart catheterization. And then once that's the patient's safe from that perspective, they go home. And again, most patients forget that the procedure even happened, and then they follow up with their cardiologist in a couple of weeks afterwards.
Okay. So it sounds like it's an easy recovery immediately following the procedure.
Yeah. So again, the recovery for the procedure itself, there's truly no recovery. The only recovery is related to the access site, that little hole that we make in the groin. And typically we tell patients, don't lift anything crazy, like don't lift like heavy boxes for a couple of days, just as that access site is healing. But for the procedure itself, specific the renal denervation, there's no recovery required, and there's no like residual pain or anything related to the procedure itself.
Okay. We had a question come in from David. He asks, how do you confirm the efficacy of your procedure in the short term?
Yeah, that's a great question, David. So we have the system itself has these electrodes that confirm good contact, and we know that we've adequately sent the correct amount of therapy to alter those nerves. That's like the technical way of saying it. And we have a pattern in which we ensure that we're hitting all the nerves involved in the kidneys. That being said, when we're done with the procedure, it's not like the blood pressure goes down 10 millimeters of mercury in the recovery room. It's a gradual decline over time. And I think Dr. Taylor will wrap up and talk about the follow-up, but we will follow these patients up on a cadence frequency, like 1 month, 3 months, 6 months, and monitoring that blood pressure and changing medications as that blood pressure falls down gradually. But you're correct, it won't be like an immediate response right after the procedure.
Okay. Lisa just asked, is there long-term durability data for this procedure yet? And can the nerves regenerate where the treatment would need to be repeated?
Yeah, that's a great question. We do have data up to 5 years and even some up to 10 years, but more the 5-year area. And what we do know is this therapy is effective, and there is long-term durability from the evidence that we've had. And there's been no evidence or suggestion that the procedure needs to be done again. This is a one-time procedure that's effective, and you get that on therapy where it's delivering the therapy at all times. And there's no evidence to suggest that we'll ever have to go back to do it again. Again, I can't really answer 10, 20 years from now because this is on the newer side, not too new, but on the newer side. But every evidence suggests that it's a very strong long-term durability.
Wow, that's amazing. What does the patient's day-to-day look like in the weeks to months after the procedure? Do lifestyle changes need to be made?
Yeah, so nothing will really change. I mean, again, they won't feel any discomfort from the procedure. Like Dr. Taylor said, elevated blood pressure is a silent disease process. So if you weren't feeling anything before, you're not going to feel anything after. But the key thing to mention are three things. One is, after you've had the procedure done, continue taking your medications. Again, this is not a cure. Continue taking the medications that are prescribed, but at the same time, continue to record your blood pressure at home to really map out and graph out that slight decline in the blood pressure. Ensure you're following up with your cardiologist so they can do office blood pressures and then also compare your log blood pressures. And then if it is starting to decline like we expect, then they can slowly start to alter the dose of the medications that you are on. That's the positive impact of it. In addition, all of the lifestyle modifications that Dr. Taylor talked about are still very important.
Mm-hmm.
This is a supplemental procedure therapy into addition what you're already doing. So continue with the diet, the low salt, alternative salt. Continue, with exercise. Continue with the weight loss medications if you're on that. Another big thing is if you're smoking, you should not be smoking. That's going to drive your blood pressure as well. So all of the lifestyle modifications and medication compliance are still important even after the procedure.
Okay, and still take your blood pressure medicine unless.
Yeah, absolutely.
And what does the frequency of appointments with a cardiologist look like after the procedure?
Yeah, so right after the procedure, you would likely see myself or my colleague who are also performing the procedure, usually around the 2 to 4 week mark. That's kind of like a procedure follow-up, making sure you're feeling okay. The little hole that we made is okay. And that's when we start, really looking at the blood pressure recording in the office and at home and start to look for those changes. And then after that, around the 3-month mark, we would like to have the patient come back, check in again, see how the blood pressure is doing, look for that positive response and alter medications afterwards. And then at the 6-month mark, that's where the patient can likely go back to their primary cardiologist or even their primary care doctor or their nephrologist, and they can manage that blood pressure long-term and continue to make those adjustments to the medication as the patient continues to respond to the renal denervation procedure.
Okay. Wow. And one more question. For anyone who is struggling with high blood pressure, uncontrollable hypertension, or someone who hasn't been diagnosed yet but is experiencing symptoms, what advice would you each give them?
Yeah, I could take the first go at this. I think, blood pressure, like Dr. Taylor said, is very common. And even though it's very common, it's often overlooked or is not optimally controlled. So if you are suffering from elevated blood pressure, or if after hearing this you go do a blood pressure test and your blood pressure is elevated, seek help. Like, make an appointment with a primary care doctor or a cardiologist, so we can start this process for you. We can look for secondary causes. We can recommend a great blood pressure cuff for you. We can start monitoring your blood pressure at home, add on medications when needed, counsel you on lifestyle modifications, and then truly follow you going forward as you're having a positive response to all of these changes that we're making for you.
Thank you, Dr. Taylor.
Yeah, there's really two things here. One is if I'll take the second part first. If you haven't been diagnosed yet, but you're experiencing symptoms, get help quickly. Having symptoms from blood pressure is very dangerous. And if you've measured your blood pressure, it's high, you're not feeling well, don't sit on that. I'll give you my own anecdote. My mother has been struggling with her blood pressure recently. She's 84. She's on multiple medications. She does her best to take them faithfully, and her blood pressures are running very high, like 180 over 100. And I was getting very concerned. They hit 200. And I was over there, and she just said she wasn't feeling well that week. I was over there, this is 3 weeks ago, and while I was there, she developed sudden speech disturbance and actually was having a stroke in front of me. So I ended up having to call 911. We got her, fortunately, by the time she got to the emergency room over in Virginia, she lives over on the Virginia side. She was better. Symptoms were resolving, but her blood pressure remained really still difficult to control, and it's only through the addition of additional medications that we're getting it better. And fortunately, she's doing well. So that's just my own anecdote of someone who was having symptoms, and even despite trying, and how it turned into an acute problem for my mother, and I'm watching over her.
Mm-hmm.
That's one. Two is, if you have uncontrollable pressure, you're really struggling, don't give up. Keep active on your lifestyle, know your numbers, take your medicines faithfully, and don't be discouraged if medicines get added on, because it can take 3 and 4 different medicines to really truly control blood pressure. It's not a sign of failure, it's a sign of how hard it is to get control of your blood pressure. But if you're on the right and fortunately medicines are more and more good medicines coming to the fore all the time to treat blood pressure. So don't give up, keep after it, know your numbers, and shoot for that optimal of 120/80.
Thank you so much. Thank you both for taking the time to share your expertise, and thank you to our viewers for watching. We hope you learned something valuable today, and if you find this video helpful, please share it or tag a friend who would benefit from watching. For more information or to schedule an appointment, visit the link in our comments or call 410-248-8465. Stay strong, healthy, and heart smart, and we'll see you next time.
Happy Heart Month.
Take care, everyone.
Good job, everybody. Have a great day.